Welcome. My name is Stephanie Schwacke. I am currently a student at Mount Mercy University working on my master's degree in nursing with an emphasis on health advocacy. I have created this PowerPoint presentation for my current class, Vulnerable Populations, taught by Melissa Walker. This presentation will discuss and examine incarcerated prisoners within the United States prison system receiving chemotherapy and/or immunotherapy. Within my current role as a staff nurse at the University of Iowa Hospitals and Clinics Holden Comprehensive Cancer Center, we care for many prisoners who are receiving chemotherapy. Their journey is different, and care can be complex and hard to navigate due to their situation and being part of a vulnerable population. By providing this discussion, I hope to educate and give healthcare providers the tools to better interact and care for incarcerated individuals. Being incarcerated places the incarcerated individual as part of a vulnerable population as they do not have the freedom and choice non-incarcerated individuals have. Being incarcerated places you at a higher risk of mortality due to a cancer diagnosis than the general public due to lack of choice and freedom to choose your healthcare provider and team, quality food and environment, and social and emotional support. As depicted in the graph above, state prisoners experience a higher mortality rate due to cancer than non-incarcerated U.S. citizens. Another important note in Health and Incarceration, a workshop summary, is that families of the incarcerated individual also face poor health and access to health care due to the void left by the incarcerated individual not being able to contribute to the functional family unit. The workshop also spoke about when incarcerated individuals are released from jail during their reentry. They are also at risk due to lack of resources, access to health care, food, housing insecurities, probation demands, and terms of their release. Why are prisoners susceptible to cancer and at a higher risk of mortality due to their cancer diagnosis while incarcerated or just released? According to Montemurlo, article published by Yale School of Medicine, death due to cancer is the top cause of death for inmates. The study looks at the state tumor registry compared to the prison data bank of prisoners in Connecticut. They looked at data for 11 years, 2005 to 2016. This study shows alarming data. Dr. Gary Gross states that this is a call to action. More needs to be done for cancer prevention, treatment, and surveillance for prisoners. Also, the root cause of why this correlation occurs must be studied, and achievable and measurable outcomes must be put into place with research protocols to prevent this horrific trend. According to Wang, a high mortality risk related to cancer diagnosis and imprisonment could be related to access to quality of care and palliative care. Also, primary care needs are not being met regarding the quality of food and emotional and mental support. Over the last couple of years, we have seen a shift in how we view law enforcement and correctional institutions. We felt as though they were above being questioned. Fast forward to today, and we can question things and mark things as not ethical or just, and can call the situation into question to improve policy and performance, or in this case, prisoner health or the health care they receive. Cultural competency and multicultural nursing are needed to improve the treatment of prisoners. Even though many of their freedoms are taken away due to their incarceration, we must be able to uphold and understand their culture to understand them on the human level and better respect their cultural beliefs and norms. By being culturally competent, we can foster respectful relationships with prisoners and provide higher medical care, thus improving health disparities. Nursing must be in a continuum of self-evaluation and education regarding cultural competency to improve unconscious bias and advocate for our patients' needs and cultural preferences. When we can respect and include patients' cultural preferences within their care, patients are more compliant with their care and thus improve their health outcomes. The above 5 bulletin ideas to improve cultural competency drive home the continuous process that cultural competency requires. This list was provided by the National Center for Cultural Competency. Within the infusion suite, I care for prisoners daily and have not had a bad experience thus far. Each prisoner has been respectful and willing to learn about the treatment that they will receive. Sometimes it is hard to converse with them as you don't want to imply I'm free and you're not, and many topics that we discuss with normal patients, that's the norm. We talk about the weather, we talk about what you're doing this weekend, we talk about your family, stuff like that. And sometimes that can be hard because you don't have that basis with the patient, which I think is something that we use to build trust and respect and rapport. So sometimes that can be difficult. But many of the prisoners, almost all of them, I feel as though their care is appropriate and good, and the facilities are doing a good job caring for them. We don't always get to see the end result. We don't always get to see how they're doing when they're done or they get released. So I think that will be interesting, as much of the data is pointing to when these people are released, their care is lacking because they don't have the resources. Shun Lee's blog about correctional nursing speaks about how to promote social justice for prisoners pointedly in the following quote: "Social justice would include reducing dehumanizing practices within the criminal justice system and extend towards improving the health and well-being of the homeless, impoverished, and undereducated communities from which our patients and their families enter into the criminal system." Shuley brings up a great point that many prisoners are already part of a population that faces health disparities before entering the prison system. Many prisoners do not have the proper health care or preventative care before entering the system, placing them at even higher risk for health issues. When focusing on cancer patients within correctional institutions, many have faced delayed diagnosis of their cancer, as many symptoms inmates may experience related to cancer do not undergo proper investigation and testing or prolonged wait times to access oncology care. Once a patient is diagnosed, they may face barriers to proper symptoms control. PNA notes that many prisoners do not receive proper pain management for their cancer when incarcerated. PNA noted a case study by Lori J. Lockholm, MD, that speaks about a prisoner who forgoes cancer treatment and goes straight for palliative care as he feels that prison is worse than death. Nursing education must include educating nurses who care for prisoners on the safety of oneself when caring for prisoners, and advocating for prisoners' health and well-being, educating prisoners on their health conditions and ways to improve their health and stay healthy when released. Public policy regarding the compassionate release of prisoners facing long battles with chronic health issues such as cancer should be evaluated more frequently, according to PNA's article. She notes that Gabrielle Imber's thoughts and statistics on aging prisoners with poor health as: the older, sick patients are not at risk to the public, and compassionate release should be considered in such cases. For example, according to a 2012 report by the ACLU, the mass incarceration of the elderly in New York, only 7% of prisoners released from prison between the ages of 50 and 64 returned to prison for new convictions within 3 years. The number dropped to 4% for prisoners aged 65 and older. In contrast, this number is 16% of the prisoners released at age 49 and younger. Furthermore, most aging prisoners are not incarcerated for murder, but are in prison for low-level crimes. Relationship between literacy and prison population health disparities. 80% of prisoners released from prison have a chronic health issue. 60% of individuals from Hayden et al.'s 2018 study had inadequate health literacy. Many individuals in the study faced health disparities and socioeconomic difficulties before entering the prison system. Health literacy is tied hand in hand with health disparities. How can an individual access, navigate, understand, and follow through regarding their health if they do not understand the hows and whys of the system and the instruction it provides for the individual? Prisoners also have the disadvantage of being unable to pick their health care providers or systems. Also, when prisoners are released, they face many obstacles to obtaining basic needs such as food, clothing, and shelter. Their health and health care can be put aside as they struggle to find and obtain the basic everyday life necessities. Literacy and decreased health literacy are a product of failing an individual from their early years. When an individual is from an underserved community, illiteracy is a byproduct of unmet needs within a community. Further work needs to be completed to ensure all individuals have the proper education to read, as reading is the gateway to allow an individual to grow and understand their surroundings, allowing for change and advocacy for oneself and the community. Compassionate release. Although compassionate release is not available in Iowa, it is an option in other states and from federal institutions. Federal government criteria for compassionate release and new guidelines may be coming to expand compassionate release. Compassionate release of prisoners could be an option for individuals facing a cancer diagnosis and a policy that could positively impact their care, symptom management, and quality of life while facing their cancer battle. Federal criteria for a prisoner wishing to obtain compassionate release include medical conditions and someone facing a terminal illness that will lead to death. With the prison system facing an aging population, compassionate release may be seen more frequently as elderly prisoners are more likely to have increased health issues and demands and require more health supports while in the prison system, thus equating to increased costs related to their health care. Prisoners facing a cancer diagnosis face a complex and challenging road that is increasingly more difficult to navigate due to predetermined factors, many leaving the patient with little control over their life-threatening disease process. Prisoners predominantly already face health disparities before entering the prison system, leaving them predisposed to health issues and furthermore vulnerable to health issues from being within the prison system. Continued research must be conducted to improve and provide recommendations on better care for prisoners, better health care, health promotion and prevention, and prompt access to healthcare specialties. I hope this presentation has brought to light some issues prisoners face when diagnosed with cancer. Thank you for viewing my presentation.